Professor Jasmine Abdul-Qadir is performing surgery. But to her patient, this is more than just a medical procedure. It's the most important part of a long journey to help overcome deep trauma inflicted on her as a young child.
Et si on va mettre pénétration.
The patient is a woman in her late 30s to mid-40s. Originally from Somalia, she now lives here in Switzerland. As a young girl, she was subjected to female genital mutilation. We've been given rare access to film this FGM reconstruction surgery by Professor Abdul-Qadir. She's one of the world's leading experts in this field.
There are several types of female genital mutilation, so the tissues involved might be diverse. It can be the labia, the clitoris, and the cutting might be more or less severe. So there are different types of surgeries.
This patient has had type 3 FGM, infibulation. It's the most severe form, where all or part of the external female genitalia has been removed. The vaginal opening has been sewn shut, or the scar tissue has fused together after being cut. These cases require de-infibulation or reopening.
Voila. It means to avoid suffering when they pee, when they have period, in their daily life, when they study, when they work, when they take care of their families. It means to be healthy in their daily life. It means so to be socially healthy, happier. It means to enjoy sex with their partners. So it means a change of life.
Her vaginal passage was partially reopened in the past, probably during childbirth.
Sensitive nerves, but that have also branches of the cavernous nerves.
Today, she has chosen to undergo clitoral reconstruction.
We have patients that might not be interested in reconstruction, that they already feel well, sexually healthy, and other patients that suffer from severe trauma, that are unhappy with their body image, and so they will ask for reconstruction. Some of them will go for surgery, some others will not go for surgery. I think it's important to offer different possibilities depending on the needs of the patient. And as you said, it's a huge journey. Just calling to take the appointment. Some patients say, I didn't sleep yesterday. I have thought about this appointment for several months. It's only a few months ago that I decided to call because it's a subject that is taboo.
The World Health Organization estimates that more than 230 million women and girls alive today have undergone female genital mutilation across 30 countries in Africa, Asia, and the Middle East. It's mostly carried out on girls under the age of 15. In 2015, it was estimated that around 137,000 women and girls were living with FGM in England and Wales. And between that report and 2023, FGM was identified in a total of over 87,000 attendances at NHS trusts and GP practices. And the real numbers are thought to be much higher. Unimaginable cruelty deliberately inflicted on young girls.
Every girl who came in came out crying, screaming. I didn't want to go in, but they forced me, and when I went in, she cut me with a blade. I jumped from the pain. All the girls were crying. I didn't want to, but they forced me.
This is one of Professor Abdul-Qadir's patients. Jamila, that's not her real name, is still recovering after undergoing FGM reconstruction surgery last month.
I was angry because I was just a child. She had already made the decision, but I was angry, furious with her. When I was growing up, she was always around, and I confront her and asked her why. She said, it's our culture, we have to do it for the girls.
As a 6-year-old girl in West Africa, she was tricked by one of her father's wives. Jamila thought she was going to the market to buy sweets. Instead, she was dragged into a cutter's house where she was mutilated.
For me, honestly, it was exhausting. I didn't want to have to heal from it. Afterwards, they said that after 1 or 2 weeks they would have a celebration, but I wasn't feeling well at all. Physically, mentally. I always think about it. It's something that never leaves you. You think about it all the time.
Professor Abdul Qadir's team see between 20 to 30 FGM survivors a month here at Geneva's University Hospital. Not all of them will opt for reconstructive surgery, but the ones who do can access it on the country's healthcare system. FGM reconstruction surgery is available across Europe, including here in Switzerland, as well as in clinics in France and in Germany. But in the UK, the procedure is not available on the NHS, meaning many British FGM survivors must travel abroad for help. Campaigners say that must change. The demand for the surgery in the UK is growing. Juliet Alberts is a specialist midwife who runs a busy FGM clinic in West London, offering treatment and support to survivors.
We do find women coming to our clinic saying they want reconstruction surgery, and we have to say, sorry, we don't offer it here. Some of them will seek out going to have it done in another country perhaps, which is obviously very costly. And some of them don't manage to get any support for that. It may be because they've got long-term genital pain, or it might be a body image concern. So women say things like, I just want to be whole, or I want to put back what was taken away.
A parliamentary committee warned that FGM survivors face shame and humiliation when trying to access care. It's called on the NHS to provide reconstruction surgery, echoing demands from midwives and campaigners.
In an ideal situation, it would be available to everybody on everybody's doorstep. But FGM isn't a problem in every part of our country, but it is a problem in certain parts of our country. And I think that we need to be able to prioritise those areas where the need is highest to ensure that people get the surgery and the support that they need as quickly as possible. The research isn't into the merits of reconstructive surgery. The research is into where the need is greatest.
Can we put a timeline on it? When can FGM survivors in this country expect to have access to reconstruction surgery on the NHS?
I would want to see that as soon as possible. I want GPs to have better understanding of FGM and reconstructive surgery. I want people to know that this is still an issue for so many women within our communities. And lastly, I want the government, and I think that they are now, taking this seriously and putting some action behind the words that we've heard for a decade now.
The Department for Health and Social Care told Sky News the NHS runs FGM clinics which provide healthcare services and emotional and psychological support for victims. We're also facilitating further research into the effectiveness of reconstructive surgery for FGM survivors through the National Institute for Health and Care Research. FGM reconstruction surgery cannot erase the violence or the pain, but it can offer something many survivors feared they would never have. And that is the chance to reclaim their bodies after a lifetime of trauma. Ashish Joshi, Sky News in Geneva, Switzerland.